Hello, I'm Dr. Pamela Ruig, Extension Milk Quality Veterinarian for the University of Wisconsin-Madison. And in this segment of our 7 Habits of Highly Effective Milking Routine series, we'll be discussing Step 3, using a consistent pre-milking cow preparation, and Step 4, stressing the importance that teats are dry. Now, when we talk about having a consistent pre-milking cow preparation, what we're really emphasizing is the importance of understanding how much cows really like to have the same thing happen to them on a consistent manner every day. Cows absolutely love routine. And one way that we can adapt our milking processes to really meet that need of the cows is to have a standardized milking routine. That means we need to have the same pre-milking steps, and we need to make sure that the cows understand what to expect when they enter that milking parlor. Now, there's actually some older research that was done in the 1990s by Morton Rasmussen, who actually experimented with comparing cows that were exposed to a variable milking routine to cows that were always milked with exactly the same steps. In that research, they actually demonstrated that the cows that got their needs met, in other words, the cows that were milked using a consistent pre-milking cow prep, those cows actually produced 5.5% more milk as compared to the cows who really didn't know what to expect when they entered the milking routine or the milking parlor. Because variability and uncertainty is not very comfortable for cows. And so that's one of the reasons we want to make sure we do everything in the milking parlor as consistently as possible. Now, this can be a challenge on some farms, especially larger farms, because on many farms there's a variety of people who actually perform the milking process throughout the week. And so this is why it's very important to have a standardized operating procedure for milking and to make sure that everyone who milks the cows are properly trained in the use of that procedure and perform it in exactly the same way. When we're looking at providing that consistent pre-milking cow preparation, we actually have a couple of objectives. One objective of that routine should be to provide enough stimulation to allow for effective milk letdown. The second objective is to make sure we have a process in place where the milking technician can identify abnormal milk from a gland that has clinical mastitis and make sure that that milk is not included in the bulk tank milk that'll be used in the human food supply. One of the most essential aspects of this consistent pre-milking cow preparation is the use of force stripping. Force stripping, or the removal of 3 streams of milk from each quarter before application of the milking unit, is an extremely important part of a complete milking routine. One of the most important reasons to force strip is that it's excellent stimulation for milk letdown. But the second reason it's very important to include force stripping is it's the only method that we have that allows us to detect the most common type of clinical mastitis. And that is the 50% of cases of clinical mastitis that present with the only symptom of having abnormal milk. So if we do not have force stripping, including in our pre-milking routine, and if we don't observe that milk before we attach the milking unit, those cows that have mild cases of clinical mastitis will be missed, and that milk potentially could be included in the bulk tank. Now, the most common question I get asked about the process of force stripping is when in that pre-milking process should force stripping occur? Should it occur before the teat disinfection or after the teat disinfection? And that question was asked of me so frequently that we actually performed some research and took a look at trying to answer which is best. So in one of our papers published in the Journal of Dairy Science in 2005, we actually had enrolled about 88 dairy farms from here in Wisconsin. And on those 88 farms, 35 of them force stripped before they disinfected the teats using pre-dipping, and 53 of them performed that disinfection step, the pre-dipping, before they force stripped. We looked at 4 separate outcomes at a herd level on these farms. We looked at the milk per cow. We looked at the number of cows milked per hour per milking technician. We looked at the monthly clinical mastitis rate, and we looked at the new subclinical rate using DHIA somatic cell count values. And in no instances could we find any differences in any of those outcomes between farms that force-stripped first and then pre-dipped, or farms that pre-dipped first and then force-stripped. I didn't really like that outcome because my opinion had always been we needed to force-strip first before we pre-dipped. But our scientific data didn't prove that. What our data says is that you need to do both of these processes, but you can optimize the order of them for your particular farm circumstances. And that's good because it gives us more flexibility in our milking parlors. So here's an example of the process of pre-milking preparation where we're looking at force stripping and teat disinfection. Couple of key things to remember. If you happen to milk in a facility where the cows are also going to live or lie down, like in a stall barn operation, a smaller stall barn, tie stall, milking in a pipeline, really important to remember, never force strip onto a lying surface of a cow. If you're force stripping in those instances, you need to force strip into a strip cup. If you force strip on the floor of a parlor, those floors need to be washed between every side so that the feet of the cows entering don't become contaminated with leftover milk from the cows that were in the stalls before. And most importantly, make sure you wear nitrile or latex gloves so that you can properly clean your hands or change those gloves if your hands come in contact with infected milk. Traditional methods historically of teat disinfection started off with using sanitized towel, clean sanitized towel followed by drying teats. And that's how I was taught many years ago. But in the mid-1980s, groundbreaking research was done that experimented with the use of application of a disinfectant pre-dip to the teats, an appropriate contact time of that pre-dip with the teat skin to allow for killing of the bacteria, followed by effective drying and removing of that disinfection. And what that research demonstrated was that there's no doubt that the effective use of a pre-dip followed by drying is the way to effectively reduce bacterial counts on teat skin and is the most effective method that we have to properly disinfect teats before attaching that milking unit. Now, the procedure that we need to follow means we have to use a good commercially formulated pre-dip. We need to apply that pre-dip to completely to debris-free teats, and we need to allow sufficient contact time of that pre-dip, approximately 20 to 30 seconds depending on the dip, with the teat skin before we wipe it off in order to allow for an effective killing. Now, I just want to comment on the debris-free teats. If cattle enter the milking parlor and they have sand or debris on their teats, what we need to do before we apply the pre-dip is take a dry towel and do a quick wipe to remove that. Then you put the pre-dip on, allow your contact time, and then, of course, allow for effective drying. Now, when we look at this disinfection step, it's not just the application of the pre-dip that is important. Drying is probably one of the most effective ways to reduce the bacteria present on that teat skin. There's again research done in the early 1980s that show a tremendous reduction in the bacterial count of teat skin when we combine the use of a sanitizer applied to a teat with effective drying as compared to the use of just a sanitizer by itself. Now, when we look at drying teats, one of the things that we need to think about is what type of towel should be used to dry teats. And what we really want to do is make sure we have a clean and dry towel of an effective size, and that can be either a single-use cloth towel that's discarded after it's used on the teats, or it can be a well-laundered cloth towel. And if we decide to go the well-laundered cloth towel, we need to make sure that we've got an effective washing and drying process for those towels used to dry the teats. And there's good research coming out of Washington State that shows the combination of either drying at high temperature, the use of bleach in your wash water, or the use of a good detergent followed by drying can be an effective method to clean those towels. One thing I will caution you on is if you're washing and drying the towels on your own farm, make sure you clean your washing machine and also have a washing machine that isn't overloaded and has enough water to do an effective job of cleaning those teats. So when we're evaluating milking routines, often we want to figure out, are the milking technicians effectively getting those teat ends clean enough? And to do that, one of the methods that we often do is we'll take a small white gauze swab and rub the end of each teat immediately after the teats have been disinfected and dried, but before the milking unit is attached. When we do that, we use a 4-point scale. 1, the teats are clean. 2, the teats are clean, but there's a little dip present. 3, there may be a small amount of dirt or manure present. And 4, the teats ends are obviously dirty because those little gauze swabs are soiled. If you want a standardized process for this, we've got a teat cleanliness scorecard that you can download from our website. But remember, the objective really is that the vast majority of the teats should always score as 1s, clean. If the milking technicians are well trained, well supported, and have the right tools, they should be able to achieve that. So we've been going through the 7 habits of the highly successful milking routines. And this week we talked about step 3, the consistent pre-milking cow preparation. That pre-milking preparation always includes forestripping for stimulation and also includes observation of that foremilk for detection of those mild cases of mastitis. And then the 4th step is sufficient disinfection and drying of the teats to ensure that milk is obtained in a hygienic manner.